So in primary care now we're seeing a lot more women with type 2 diabetes in childbearing age that could potentially become pregnant, so it's becoming very vital to give them preconceptual care just so that we can reduce adverse events in their pregnancy and have successful outcomes for the women and the babies. NICE guidance tell us that it's very important that women of childbearing age, they're given preconceptual advice or contraceptive advice at every consultation that they have with the healthcare professional. So it should be an integral part of the diabetes annual review and review follow-ups.
Giving preconception information to women with diabetes is vital. We're seeing increasing numbers of women either at high risk of diabetes or with established diabetes of childbearing age. And as we all know, pregnancy complicated by diabetes is associated with adverse fetal and maternal outcomes. So therefore it's pivotal that we give preconception information to these women at a very early stage, even when they're just contemplating pregnancy.
So the information I'd give to women that we're planning to become pregnant and they have diabetes, it's very important that they know what sort of glucose controls are best for long-term outcomes. So it's important they know what HbA1c they should be aiming for. It's important that they know what their blood glucose levels should be. It's also very important that they know that they should be taking folic acid, and that's at 5 milligram dosage. And it's very important to let us know as soon as they become pregnant so that we can direct them to the correct services straight away. I think it's very important for women with type 2 diabetes that are planning to become pregnant, or with type 1 diabetes as well, that they have an understanding of how high HbA1c levels can have an adverse effect not only on the pregnancy but on the baby, and it's also important to make sure that they know what is the best health they can be in to get successful outcomes.
The first and most important information I would give to any woman with diabetes considering pregnancy is go and speak to your GP and/or nurse. There's a number of important considerations to take into account even very early on when women are just contemplating pregnancy. Women can be referred to their antenatal clinic at a very early stage to discuss a plan of action where they can talk to dietitians, diabetic specialist nurses to ensure that their diabetes is well controlled, to give advice about maintaining a healthy weight during pregnancy. Eye checks need to be done more frequently in pregnancy. There needs to be more intensive monitoring of blood sugars in pregnancy as well. So there's a number of issues that need to be addressed very early on, even when women are just contemplating pregnancy.